So again, we talked a little bit about the calories in, calories out myth. I've already talked about the IHBLTs, which you can see there on the screen. We've talked about the hypothalamus and the hypothalamic set point. What we didn't really talk about, which we'll go into a little bit here, is that your body changes its metabolic rate in response to your hypothalamic set point. So there have been studies that show that when you lose weight, your metabolism slows because the body doesn't want you to lose too much weight. And actually, the same holds true in the other direction. There have been studies where people have artificially gained weight on purpose, and then their metabolic rate increases because the body wants to be back at the weight that it thinks it should be at. And again, there's some emerging data that suggests these ultra-processed foods may raise the hypothalamic set point, and that might be why the obesity epidemic continues to trend upwards. But we haven't really, I can't say that the data supporting that are solid as of yet. So we all know that different people have different responses to calories. And there are also some other medical conditions where, again, the calories in, calories out balance changes. So for instance, people with, or women with PCOS, polycystic ovarian syndrome, we know that they have insulin resistance and other metabolic derangements that far outweigh their BMI alone, and it's really difficult for those patients to lose weight, even if they are in a huge caloric deficit. For older women, menopause is a time where women tend to put on weight, and for a long time that was thought to be normal, but it can lead to metabolic problems, just like any weight gain can. And most women will relay that they don't change anything in terms of their diet and exercise, but when they go through menopause, they just gain weight. And so it can't simply be calories in and calories out, because that doesn't change, yet weight gain occurs during menopause. And then, as we talked about earlier, there are mental health conditions, and actually, unfortunately, a lot of the medications that are used to treat mental health conditions cause weight gain. So it's not really just a simple math problem. It is far more complex. It requires holistic thinking about the disease and about the patient. And then it requires different treatments depending on what the different contributors might be. So again, if people want to, the only way we could ever scale obesity care in the United States or in the world is that primary care providers learn about the disease and treat it. But if you're not there yet, please refer to specialists who might have more knowledge on the topic.